Good morning. Welcome to the second day of the board's July 24th, 25th, 2019 board meeting. My name is Greg Lippy, acting president for the board. Before we get started, just a few housekeeping items. If you're interested in receiving continuing education credit for your attendance today, please remember to sign in and out on the designated sheet. This meeting is being webcast. We respectfully request that when called upon to speak, that you please come to the speaker's table and speak directly into the microphone. This will ensure those individuals watching the webcast are aware of all discussion and action. As indicated on the agenda, the board has a significant number of items for consideration. Items may be taken out of order. If necessary, public comment on the various agenda items may be limited to 3 minutes per individual. We respectfully request that individuals providing public comment be respectful of board member time and refrain from restating comments previously considered by members of the board, whether those comments occurred during the committee meeting or during this meeting. Thank you in advance for your consideration and cooperation. Also, the board will convene in closed session. Upon conclusion of closed session, the board will reconvene in open session and will adjourn the meeting in open session. The board does not intend to webcast that portion of the meeting. I thank you all for attending, and I will now take a roll call to establish quorum. Starting from my right, please.
Ricardo Sanchez, public member.
Albert Wong, professional member.
Greg Lippy, public member.
Debbie Veal, professional member.
Alan Shadd, professional member.
Thank you. Now that quorum's established, we can begin. The first report will be on Organizational Development Committee. The first report, which is Organizational Development, has not, the committee hasn't met. So I'm going to be providing information updates on general items. First is the budget update report. Starting with a report on our budget as indicated in the meeting materials, fiscal year-end figures are not yet available for fiscal year 2017-18. Further, year-end figures for 2018-19 cannot be produced until the prior fiscal year closes. Staff has reported preliminary figures for fiscal year 2018-19 in the meeting materials, which indicate the board estimates it received about $25.5 million in revenue. Preliminary expenditure figures are only available through May, which indicate expenditures of $20.2 million for the first 11 months of the year. Also provided in the materials is the board's fund condition report prepared by the DCA. As indicated in the report, based on current information and projections, the board's fund will be reduced to 0.4 or 4 months in reserve by the end of the fiscal year, and then slowly starts to restore in subsequent years. The slow rebuild of the fund assumes the board's fee regulation is approved and becomes effective next calendar year. Are there any comments on the budget report from members? Public? Next item is board member attendance information. Attachment 2 includes a summary of board member attendance for the last fiscal year. The attachment demonstrates the significant time commitment we make as members of the board. Thank you all for board members for your commitment to the board and its mission. Are there any member comments? Any public comments? Thank you. Next is discussion and consideration of committee meetings and board meeting dates and location for fiscal year 2019-20. Attachment 3 includes the board and committee meetings currently scheduled for the remainder of the fiscal year. You will notice that the schedule reflects the action taken during our May meeting seeking to consolidate board meetings and committee meetings. Staff are working to finalize some meeting locations. Where final, the information is included in the attachment. The information will be updated on our website as well. Next is discussion and consideration of designating all or portions of the decision in the matter of the citation against Omnicare, Inc., Omnicare Holding Company, DBA Omnicare of Cerritos, and I won't list all the case numbers and so on. Let's see. As detailed in the chair report, staff is recommending that the board designate the decision in the matter of the citation against Omnicare as precedential. Provided in attachment 4 is a copy of the decision as well as a memo from our counsel, Kelsey Pruden. As noted in the meeting materials, making this case precedential would clarify the legal requirements for supervising a pharmacy technician, and that general awareness of a pharmacy technician's function is not sufficient to meet the standard required by board regulation. Any comments from the members?
I have a question. I believe is better than a comment, and that's in the board materials. There's a document that lists the legal conclusions. I believe that's something that you put together.
Or is it the proposed decision?
Post
I
decision.
think it's the proposed decision.
I see it. In the, so I can, this is not something I can read or.
Yeah.
In the proposed decision number 7, it defines what direct supervision and control means. There's a definition in there. And I'm just concerned about the word in here that says that a pharmacist is on the premises at all times. And that seems to be one of the major points of the presidential, I can't say the word now.
Presidential.
Thank you. Decision and the case that the pharmacists were not in the same room to visualize the technicians. So I just wanted maybe a confirmation or discussion as to why that definition does not apply, or is not applied as broadly.
So that particular definition in 7 comes directly from Business and Profession Code Section 423.5. And in this particular case, it's really, it's adding more definition to 17937.7F. And it's that when a pharmacist is filling prescriptions, they need to be aware of what is going on with the pharmacy technician, not just in another room or on duty. It needs to be active supervision. So that's what this particular precedential decision would be adding to the regulation, essentially. Instead of doing a rulemaking on it and further defining it in the rulemaking, by designating this decision as a precedential decision, it adds that portion of it into 17937.7.
So I thank you. I understand that a little bit better. My concern is just from a legal perspective, how this will be used in the future for other practice settings. There are many pharmacy practice settings where pharmacists work with technicians, and they're not necessarily in the same room, but they're not also filling prescriptions per se in that way. And I'm just wondering how that will affect other practice settings where, well, let's say the pharmacist is out on rounds, or the pharmacist is doing chart review in a long-term care facility, or those kinds of things where they're in the building, but they're not eyes on.
According to the code, it says the pharmacist is on the premises at all times. So premises means the whole licensed premise, not the specific room.
Right, but the decision that we're discussing is about being in the same room.
Well,
so it seems to make it a
the
little
way,
bit more specific.
with all due respect, I interpreted that it's an awareness of the activities of the pharmacy technician, and whether or not there's a general awareness, not where they're physically located on the premises.
And so I think to your question, so we have that definition in Business and Professions Code. That applies no matter what. No matter what we do with this decision, 423.5, where it says that they need to be on the premises at all times, that applies. That already applies.
So this decision is not making that more strict.
No. What this decision is doing is, in particular, for the preparation of a prescription for an inpatient of a licensed health facility and for a patient of a licensed home health agency. It's adding, right now it only says the ratio shall not be less than one pharmacy on duty, for a total of 2 pharmacy technicians on duty. What this precedential decision is doing is adding to that and saying that it's not just that you have to be on duty, it's that you have to be aware of what those pharmacy technicians are doing. And even if you have, in this particular case, 9 pharmacists on duty, the only ones that are going to count towards that ratio are the ones that are actually supervising and aware of what is the pharmacy technician is doing for the preparation of prescription.
And
Yeah.
code section 402-3.5 says that the pharmacist has to be fully aware of all activities.
How do you define fully aware? Does that mean in the same room, eyes on?
No.
Or
I think where you're getting hung up is that this is for, you have to be aware of the specific functions that the person is doing at the time. It's not just a general awareness of what technicians do. in
That's
general.
correct.
So I just wanted to
So
clarify, like,
you just have to know what they're doing.
geographic.
As long as,
Because if I leave the room, does that mean the technician has to stop? 'Cause I've lost
no,
the
because
room?
you're still on the premises.
Okay.
Well, I have concerns to the wording of this also. Like in the hospital situation,
You're still in the premises. As long as you know that your technician is over there doing whatever they're doing and you know what it is they're doing, it doesn't matter where you are on the premises as long as you're on the premises.
But I
And that's in the
actually,
building.
you started your question, which I kind of want to have answered, because when I read this and the summary in our materials, I thought you were saying the eyes-on thing. That's what it seems like you're saying, is that because they didn't have eyes on, that was the issue, not that they
When
weren't
preparing
aware.
a prescription.
I'm sorry?
When preparing a prescription.
So, no, wait,
So not necessarily the other duties, because there are duties that don't
Right.
require direct supervision at all times.
Okay,
for
but
a
you're
pharmacy
saying that
technician.
whenever someone is preparing a prescription, that the pharmacist has to
be
have eyes on.
Yes, so
And
what,
that's not what's in here now, but that's what you are proposing.
right, so the outcome of this case that the board adopted essentially adds more to the regulations that are already in place. And it would sort of, it would sort of read that direct supervision is also required, not just, can't just have the pharmacist on duty, the eyes on when the pharmacy technicians are preparing prescriptions for an inpatient of a licensed health facility and for a patient of a licensed home health
That's my
agency.
concern.
That's,
Yeah.
I would agree with
Is
you,
I think
Maria.
I'll give you 2 situations where it's not about the case, because the case, it sounds like the other individuals were doing administrative work and we're not even aware that there were technicians in the building or in those premises. So it's not about the case, it's more about the presidential
President.
decision. Because there are many situations where the pharmacist is not physically present next to the technician. An example would be in outpatient, preparing a prescription that the patient's going to take home. I could be going to an adjoining room to do counseling, or I could be going to the restroom.
Yes, well, that's
The
why I
pharmacy
said restroom
technician
and
could no
lunch.
longer perform in
Yeah.
an
Yeah.
acute care setting where you talk about inpatient. I have pharmacy technicians who are
Yeah.
making IVs
Yeah.
in a sterile prep room adjoining. I may or may not have a camera with them, or I may or may not be in there, but I'll be coming back and forth. So they are actually, they're not finalizing, and just like in the outpatient area or the inpatient area, they're not finalizing the prescription, and you're still checking with what they're doing. But I'm not 100% there, eyes on.
And
So that's my concern, is it could be misinterpreted and
Yeah.
Great. How about those satellite pharmacy that you on the rural area? You don't even have pharmacy. You have camera thousands of miles away, and that's okay.
Or you have eyes on in that
Yeah.
case.
Yeah, I mean, yeah, somebody that pharmacist will constantly look at the camera, right?
Right.
May I add here?
So there is one other principle, and what I may suggest at the end of this is taking into account of the comments of the board members. This may be, we may take it back and then maybe bring it to another board meeting. But there's another principle here, which is that this case could stand for, which is that the inspector was present for 90 minutes, during which time numerous, I think it was 6 of the pharmacists didn't come out of the back room and didn't see what was happening. And that too, I think, might have value for your regulated public, because the ALJ in the analysis did say that he was giving the credit, if you will, for the pharmacist in charge, who did temporarily leave the space where the technicians were working. So, you know, the brief
Not
departure isn't necessarily it doesn't have to be the crux.
but it seems like we've got two different issues here. We've got one, this particular case, which I think we're all in agreement with. Okay, I think the inspector was correct in his assessment of the situation. But we're afraid in the interpretation, if we're using this as a presidential piece of case, that in the processes that we're all familiar with, we trust the technicians that work to be done without direct supervision, like Maria mentions in the IV room or on the satellites, filling the drug machines. There's tons of things that they do without direct supervision. We'll check it off, and we're afraid that if we use this as a presidential case, that we're going to have our hands tied, and it's going to increase the labor requirements beyond what we're capable of, and we don't want to be too restrictive, and that's our concern.
Well, I also think that the other thing is, you know, we've been, with SB 493, you know, we've been giving the pharmacists all these other duties, and I think as Maria said, you know, if they're in another room and, you know, you could have, like, if you have a couple CMRs you're doing, or you're, you know, working on a couple vaccines, there could be a time period where you're not physically in the pharmacy. And I don't want to get into the corner also to say, well, it's okay if you're not in the pharmacy for 10 minutes, but if it's 15 minutes, that's not good. So, I mean, I'm worried about even where you're thinking about going is not going to be okay. I don't think that this should be set as a presidential case, because I think it takes, you know, our practice to a level that we don't want to go.
Okay. All right, we'll move on.
Public comment.
No,
Are you going to do
No.
public comment, or we don't even vote?
well, there's no vote, because, yeah, there's no motion.
Okay, perfect.
But any item on the agenda requires public comment.
Oh, okay. Yes, we have public comment.
Welcome back, Ken.
Good morning, board members, and thank you for the opportunity.
Morning, Ken.
Is that you or me?
So everybody knows this is Ken Schell, former president of the State Board of Pharmacy.
And I've had the honor and privilege of serving the board for 8 years, and I appreciate every minute that's spent on the board. Ken, for those who may not know me, my name is Ken Schell. I've been a licensed pharmacist since 1984. My primary practice setting is hospitals, although I did have the opportunity to work in the ambulatory care setting. I agree with the comments of the board members with regard to the scope of this presidential decision. It would, in fact, cause some serious issues, especially with smaller hospitals. And the opportunity to have eyes on for a technician has been modified substantially since I became a pharmacist in 1984. In this situation, if you were perhaps in a clean room, the pharmacy essentially would have to stop. If there was an urgent need for the pharmacist, or a patient was having severe issues with life, the pharmacist has to leave the pharmacy. proposals for activity until the pharmacist returns. The pharmacists in the hospital on that shift are aware every minute of the day what the technicians is doing, whether they have direct line of sight or not. I currently consult with a small hospital in South Lake Tahoe. There are times during the day where there's only one pharmacist on. In the situation last week where the patient had a drug incident, if the line of sight issue had taken place here, the pharmacy would have been closed for 90 minutes until that issue is resolved. That means no care for any other inpatients would take place. So again, I appreciate the opportunity for having direct line of sight. It is important that the pharmacists know what they're doing. If a pharmacist is taking duties that take away actually know what the technicians are doing, I absolutely agree. But to make this a precedential decision would be jeopardizing what has been the standard of care for pharmacy for at least in my opinion since 1984, that the pharmacists are aware of the technicians are doing. And this has been the interpretation since I've been licensed, that it doesn't have to be line of sight with supervision on the premises as in 4.2.5. Again, I appreciate the opportunity to comment, and I hope the board, at least if they want to have further discussion, I would them to at least consider maybe a small subcommittee and maybe even involve some pharmacists to discuss what the implications would be, how to enhance patient safety by having correct legislation and oversight requirement for technicians. Thank you.
Thank you, Ken.
Good morning, Mark Johnston with CVS Health.
Good morning, Ned Milinkovich, back for day 2. I liked it so much yesterday that I came back for a second day. I'm with the law firm of Mudd Schellist out of Chicago. I'm here today on behalf of Omnicare to voice deep concern regarding case number CI 201463230, being designated as precedential pursuant to Government Code Section 11425.60. The case was styled as the matter of Omnicare Holding Company, DBA Omnicare of Cerritos. On November 22nd, 2016, the complainant, Ms. Virginia Harold, issued citation number CI 201463230. The citation imposed a fine of $5,000 because it violated, because the pharmacy was alleged to violate 1793.7F. And F is important to remember for the purposes of this discussion. The cited violation was based on the inspector's alleged observation that on May 2nd, 2016, 3 pharmacists were supervising 9 technicians as they performed their licensed job duties in violation of the regulation requiring a ratio, and that's an important word also, of at least 1 pharmacist on duty for every 2 pharmacy technicians on duty. With all due respect to this Board of Pharmacy and to the staff of the state of California, of the board, this case was incorrectly decided, and it is going to have an adverse impact on the practice of pharmacy in the state of California. And I think the old adage, the bad facts make bad law. Mr. Mark Johnson sits next to me. He is one of the senior directors of CVS, and he can detail some of the reasons as to why we believe that designating this case as precedential would hamper the ability of pharmacies to deploy their staff within the pharmacy in a way that best promotes patient health and safety. I'll state for the record that the $5,000 fine was levied against the pharmacy ultimately. I will also state that this is a ratio rule. F is a ratio rule, not a supervision rule. The simple fact is that under subsection F, you do not have to be someone who is engaged in direct supervision in order to count toward the ratio. You only have to be present in the pharmacy. In fact, here there were 7 pharmacists physically present in the licensed pharmacy space, and there were 9 technicians. There were in fact more than enough pharmacists to meet the on-duty 1 to 2 pharmacist to technician ratio. The supervision rule is something separate and distinct, and it arises under subsection B as in boy. Each technician must be supervised. That's clear. As long as each technician is being supervised, a pharmacy is in compliance with subsection B. And the pharmacy is in compliance with subsection F, so long as there is one pharmacist in the pharmacy for every 2 technicians who are in the pharmacy. So subsections B and F are easily reconcilable with one another. But there's a second reason why this case doesn't correctly apply the law. Even if you accept that a pharmacist only counts toward the ratio under subsection F if he or she is engaged in direct supervision of a technician, direct supervision does not require a direct line of sight from a pharmacist to a technician. The definition of direct supervision requires only that a pharmacist be at the premises and be fully aware of the activities of the technician. A pharmacist doesn't have to be in the same room as the technician in order to have that awareness, so long as the lines of communication are clear. So long as you have the requisite number of pharmacists present on the premises, a single pharmacist, I contend, a single pharmacist who is fully aware of all activities performed by the technician, even if there is no direct sight line to the technician, should fulfill the requirement of subsection 1793.7.
Excuse me for a minute. We're not trying to relitigate that case. So if you could confine your comments to this, whether it's a presidential decision or not.
The ALJ's opinion does not provide guidance for pharmacy permit holders. It leaves unanswered the questions of how pharmacies can lawfully operate within the licensed premises. How long can a pharmacist be out of the room? Does there have to be a window between the rooms? Do you have to have cameras? It doesn't answer the questions. Mr. Johnson can discuss some of the particulars of how this case affects operations.
Sure. First off,
I'm gonna have to start with the 3-minute rule, so I'll start now.
Okay. Well, I just wanted to thank the board for historically being proactive for expanded pharmacist care. And expanded pharmacist care doesn't typically happen behind the counter with eyes on a technician. We just heard a bill yesterday for HIV prophylaxis. And when a patient comes in, that's a very confidential issue. You're going to take them to a confidential area on the premises. You're not going to have eyes on the technician. Immunizing happens in a separate room. There's countless examples that you support that would be contrary to this decision. Specifically to this decision, as pharmacists, we have to multitask. And when we multitask, perhaps the chance of error goes up. It's best to concentrate on the task at hand. I believe it's best for one pharmacist in this situation to be overseeing all the counting technicians, and the other pharmacists they count in ratio are doing the cognitive services in a different room. And that fulfills the requirements of the rule where the techs are supervised, and it's better for public safety as everybody concentrates on their task at hand. So again, I don't think this should be precedential because it was a certain situation in long-term care that shouldn't be expanded to all other practices, but I actually think it's incorrect for long-term care too.
Thank you.
So I'm sure, and I don't want to be argumentative, but I don't believe that the attorneys on this side of the table would necessarily agree that the conclusion in the decision.
I understand. We're not relitigating, so.
Right.
Yeah,
I just
we
wanna-
understand that.
It's fine, obviously.
Good morning, members. Danny Martinez with the California Pharmacists Association. Generally agree with the public comment that's been given so far, also with some of the board member comments. In regards to some of our smaller independent settings, having direct line of sight on a tech is difficult now as it is, and given the limited resources that some of our smaller independents have, there's frankly no realistic way that this would ever work. Even when some of our independents are operating the remote dispensing ADDS machines, there's no way that can. That's destroying the spirit of the law. And yes, on the bill dealing with HIV PrEP and PEP, which we're a co-sponsor of, we want the pharmacists to be able to do these services with HIV. Cannot do that in an independent setting. So I appreciate where the board seems to be going to not adopting this as a precedential decision and would support that effort. And yeah, so thank you.
Thank you.
Good morning. Steve Gray, California Society of Health System Pharmacists. Just very briefly, we agree with the comments that were made by board members Serpa, Veal, and Chad, and I think some of the feelings of the other board members. I just want to add a couple points that haven't been mentioned. So for an example, I think that council misinterpreted the term premises. The term premises, as I've mentioned before, is ubiquitous throughout the regulation, but every place that it's used, you have to kind of figure out the context because it means different things. So for an example, when she mentioned that when they go outside the licensed area, they're outside the premises. That's not necessarily true depending on how you interpret that. For an example, the regulations allow that records can be stored outside on the premises, but outside the pharmacy. You know, you can store records that are required to be kept for 3 years on the premises, and the board has allowed that to be a room across the hall as long as it's under pharmacy's control, et cetera. So there's an example, even in an outpatient pharmacy, where the premises does not mean the four walls of the pharmacy. Also in a hospital, remember that the licensed entity is the hospital, and there is no defined premises for the pharmacy. The drugs can be used throughout the hospital. They can be acquired throughout the hospital. That's why the hospital has the license. And a long time ago, before everybody but a couple of people I won't look at were born, the board used to require floor plans to be submitted for every licensed pharmacy. They gave that up 2 decades ago and no longer require floor plans that physically decide the pharmacy. So every time a pharmacist, as was mentioned, goes out, let's say in a typical chain or a typical supermarket pharmacy and consults, helps the patient in the OTC area decide on a drug, et cetera, they're perhaps outside what some people would call the premises, but it again depends on what you're talking about. The other thing to keep in mind is how important this is to patient consultation. And in fact, this law and that definition has been gone over many times in the history of this board. And there were no licensed pharmacy technicians in an outpatient pharmacy until the law required consultation. And then what was understood was that if I'm going to be out front counseling a patient as required by law and as required by federal law for Medicaid patients, then I need help back there filling prescriptions. And so the typical setup was that you would have technicians lined up. You'd have an inputter at one end, you'd have an assembly line, and you would have one pharmacist checking every prescription. And whether it's the hospital or whether it's an outpatient pharmacy, fully aware can mean I know what they're doing and I'm approving everything before it leaves. I'm fully aware of what they've done. And so I think that those are very important things to consider when we go forward, perhaps at the next meeting with some further discussion. Thank you.
Good morning. I'm John Gray. I'm a registered pharmacist with Kaiser Permanente. I'll keep these remarks brief because I think most of the key issues have been covered. I just want to thank the board for the opportunity to engage in discussion on this important issue. We concur with the concerns that have been expressed by members of the board and of the public, specifically some of the key issues that have already been addressed around sterile compounding and temporary absences of a pharmacist from the pharmacy space. And so we respectfully request that the board not adopt the Omnicare decision as precedential.
Thank you.
Thank you.
Good morning. Robert Stein from KGI School of Pharmacy, speaking as an individual. I echo all of the testimony that's been given this morning so far, and I also want to point out a legal argument for why this should not be precedential. It sounds like what is being interpreted as direct supervision is what under 4127.15C3, which was the hospital satellite sterile compounding law, which is relatively recent, that uses the term immediate supervision. If you look at immediate supervision, that seems to be what the boards, the inspectors are now interpreting to be direct supervision. And I think if you look at the distinction between direct supervision and 4023.5 and immediate supervision, as in that hospital satellite compounding, there's clearly a distinction between those two, and I think that this is blurring that distinction. Thank you.
Thank you. Okay, one more. Getting your exercise on.
Yes. Second day also.
Right.
Good morning, board members.
Good
Thank you for
morning.
this opportunity. My name is Daryl Moore. I'm the Chief Pharmacist with California Department of Veteran Affairs. And I just wanted to bring up an issue regarding the ADDS automated dispensing device systems. A lot of the locations, they're very short for pharmacists. And I think it's the board's intent that we be able to provide pharmaceutical care to those rural locations and those places where it's hard to bring pharmacists in to work. As Mr. Wong stated, we have some premises such as in Reading where you can't get a pharmacist. Maybe there's only 3 pharmacists and they work at the 3 local retail pharmacies. But we still have to provide medications to our patients at the nursing homes. So what we've done is allowed a pharmacy technician to work with the ADDS machine. We have cameras where we're able to view the technician, and also they can do the data entry of the prescription. So my question was for clarification, if this ruling is going to say on the premises, first of all, we won't be able to provide that pharmaceutical services. And also, pharmacists do verify the work, even if it is electronically that comes in, because through our pharmacy program, that prescription that the technician types cannot go any further without the pharmacist checking it off. So I don't know if that on the premises is going to affect this situation in these locations, and if we're still going to be able to continue to provide service to those patients in the outlying areas.
So if I understood your question correctly, first of all, I don't think that this would only, if this precedential decision were adopted, this would only apply to inpatient patients of a licensed health facility and licensed home health agencies.
Okay.
And then the regulation also specifically exempts veteran affairs.
Okay, thank you. That works for me.
Thank you.
Appreciate it.
Any additional comments? Okay. Well, I don't have a motion, so we will move on. Thank you. Next item is an update on implementation of the acceptance of credit cards for renewal payments. I spoke with a very happy person this morning who told me that he was waiting and waiting and waiting to be able to use his credit card for renewal, and it actually worked, so kudos to Ken. Okay, our next agenda, well, as indicated in the meeting materials, for 6 license types, we're able to use the credit cards. Data demonstrates that the renewal payments received online continues to increase, with almost 40% of renewal payments submitted online via credit cards in June 2019. Next item is, are there any comments? No. Next item is Sunset Report Update. As we've discussed for a few meetings, the board will be undergoing the Sunset Review process this fiscal year. To date, we have not received the report template, but staff are working to collect data based on prior reporting data requirements. For your information, included in the meeting materials is a timeline of the process prepared by DCA. Okay. Do we have any comments from board? Public?
Steve Gray, as an individual, just a clarification, and because I've lost track. Is sunset review this year mandatory, or is this a option that they could put it off till next year or something like that? I just don't know.
I'll let Ed respond.
Yeah, to meet the legislative deadline, we need to follow the course this time around. There would have to be legislation outside of the sunset review process to extend the board.
So it would actually take a bill, or is it a decision that the leadership of the legislature could make to postpone it a year?
Within the statute establishes the dates for the board. So
Okay.
it would require legislative action.
Thank you very much.
Any additional comments? Okay. Personnel update and update on the relocation of the board office. The meeting materials include the list of staff vacancies. These positions are in various stages of recruitment. Also, as indicated in the chair report, the relocation of the new board office occurred in June. Next item, update on implementation of SB 1447, automated drug delivery systems. Discussions on the legislation occurred at the committee and board level. To mitigate impact to patients currently receiving their medications through an ADDS, board staff started performing inspections in advance of the July 1 implementation date. Staff used information from the board's previous registration requirements to identify pharmacies currently operating ADDS. Unfortunately, as staff moved forward with implementation, several challenges with regulatory compliance became apparent. To ensure continuity of patient care and with the approval of the former president and myself, a subscriber alert was released providing an extension for compliance with the new licensing requirements. Staff has advised me that the number of ADDS licensed has increased since the preparation of the meeting materials. There are currently 345 ADDS licensed. Staff continues to work with licenses to remedy deficiencies. In addition, provided in the attachment 6 is the most recent subscriber alert along with draft FAQs.
So,
Next.
Did you update that number to 300 and some? Yeah. And maybe you said it and I didn't hear it. How many are we aware of there being?
So one of the challenges that we've had is that that's a hard number to know because people weren't maintaining their registrations. So what we thought was our world was actually not our world.
So what did we think our world was?
That's hard to tell because hospitals were required to register and now they're not required to be licensed. I believe that we had 800 active registrations when we started the process. But what we found is, like I said, people were not maintaining their registration, so people no longer were using ads, maybe like they lost their contract or something like that. We also found that there was a lot of other reporting types of things where there was weren't quite compliant with the law, so we're trying to address and remedy those so that we can move forward with the registrations.
So I'm going to put you in a spot that you're probably not going to like. About like what?
Well, then don't do that.
Yeah, but I'd like to. No.
You would never do that.
But about, so do we think maybe like about 50% of the applications, the licensures have been issued, or I mean, I'm just trying to figure out like how far out there. And the subscriber alert said, gosh, you really need to have it done by July 31st. So it's sounding like.
So to put it, I don't have an exact number for you.
Right,
to put it into context, we were looking at I think it was 3 or 7 ads were going to be ready to be issued. Like they'd satisfied the requirements July 1. We're at 345, and we actually might be a little bit higher now.
Okay.
So I think we've made very good strides,
great
and
progress,
we continue to work with people, but we can only do so much because some of it is on the applicants to to do, right? So we've been doing the inspections when we know. We try to do them in anticipation. We've been working with entities to secure compliance. And as we continue moving forward, we will be using, typically, as the board generally does, is securing compliance through education and assistance at the beginning of the transition period.
Well, so I guess my question is, so we have about 350 licenses that we've actually issued. Do you know how many others are in-house?
I can get that number for you and report back later in the meeting.
Okay. And because, I mean, I'm just curious, you know, are we halfway there? I'm just curious if about.
Yeah, let me see if I can pull up the data sheets.
All right. In the meantime, are there any public comments?
Steve Gray is an individual pharmacist. As I've mentioned before, there has some confusion out there about what the new law requires. And for an example, I believe, and I may be wrong, that the ads only have to be registered with the Board of Pharmacy if they're operated by entities that are licensed by the Board of Pharmacy. But I know that there are these machines that are operated by physicians and who are not licensed by the Board of Pharmacy, nor are their facilities licensed by the Board of Pharmacies. And so I was wondering, and if any of the applications because they were confused or whatever, came in from physicians or other entities that are not licensed by the Board of Pharmacy because they thought they had to get a Board of Pharmacy registration.
So, Council, do you care to respond to the prescriber office dispensing provisions?
The ads license can only be issued to a pharmacy.
Right. So if the machine is used by, let me restate it, if the machine is used by a physician or a dentist and not operated or in any way connected with a Board of Pharmacy, they don't have to get a license.
Correct.
Correct.
Just want to make sure I'm clear on that.
Thank you. Any other comments? Okay, I'll move on. Next item is report of multi-year comparisons of licensing and enforcement statistics. The last item for information is the 3-year licensing and enforcement statistics. In addition to the licensing information highlighted in the meeting materials, I noted a decrease in overall investigation time, down 17% over the past 3 years, as well as a significant increase in the number of citations issued with a proof of abatement. There is a slight decrease in the number of licensees on probation with the board. I also see that the overall number of licenses revoked has a slight decline, but there was an increase in the number of pharmacists whose licenses were revoked. There also appears to be a significant drop in the number of citations issued. During the Enforcement Committee, members were advised that this drop is primarily a result of staff vacancies and a resulting backlog in citations to be issued. I think an additional reason could be that I think, as former President Law stated in the past, he and I had been reviewing the cite and fines on a monthly basis with an eye towards making sure that the thrust was towards education as opposed to punishment. And therefore, I think a number of the resulting reductions in citations came about as a result of our reviews. At least I'd like to think that.
And
now,
just so we're clear, because I'm a broken record about this,
yes.
and I want to make sure that there's no confusion, those reviews were, of course, of closed cases and not the
that is correct.
Any pending action.
It was
But
reviews of closed.
As a post action
Review
review.
of closed cases to give direction towards future cases.
Thank you.
That's what we did. Okay. Thank you for the clarification. Okay. Now I'm going to turn the meeting over to, well, are there any comments about what I just said?
First off, again, thank you to you and former President Law for the review of these cite and fines. I kind of want to put it on the record now that he's gone and that you have elections coming up at this next hearing. Is it the board's intention to continue that practice?
Yes.
Okay, thank you.
Any other comments? Okay, I'm now going to turn the meeting over to the Communication and Public Education report, and Ricardo will be presenting that for us.
Thank you. Good morning, everyone. My name is Ricardo Sanchez, and I'm the chairman of the Communication and Public Education Committee. Yesterday, we had a meeting, July 24th, 2019, and I'm going to give you a summary of our meeting here. Discussion and consideration of policy and subscriber alerts. Background, the board currently has specific email lists known as listservs for communicating via subscriber alerts and with licensees. The board does not specifically list for communicating with the general public or other non-licensees. At the May 7th committee meeting, staff suggested creating new types of email lists for sending subscriber alerts to the public. The committee directed staff to report back with a plan for new email lists and to consider whether the board should set policy on how subscriber alerts are targeted or given or give staff discretion to make those decisions. At the committee meeting yesterday, staff proposed creating a new email list for the public. This email list would be used for sending subscriber alerts about board and committee meetings, consumer information, press releases, and other types of general news from the board. This would help to reduce the volume of subscriber alerts being sent to licensees. In addition, this would help the board more effectively communicate with non-licensees. The committee discussed adding a new email list for the public and another new email list for receiving all types of subscriber alerts. Staff recommended the executive officer have discretion to create additional listservs as needed to determine which types of subscriber alerts are appropriate for each email list. The flexibility will result in better targeting of messages and less volume for licensees. The committee adopted the following recommendations to the board. The recommendation is to delegate to the executive officer the ability to expand the board's listservs to provide more flexibility in communicating with various groups and avoid overloading any listservs with subscriber alerts. Any board comments? Okay. Public comments? See none. I would like to have a motion. Go ahead. I don't see anybody. We move along real quick with this one. No. Can I have a board has no comments, right? So can I have a motion to accept this motion? I mean, I can have
I think
a motion.
didn't the committee have a motion to the board? I know it's not in our notes, but I thought during our meeting we had a. Okay.
We need
So it's already a motion.
Yeah, we need a motion to give delegate the executive officer the ability. Yeah, to
You
approve
want us
it.
to approve the committee's motion?
Yeah. Sorry.
That's okay. So, and no public comment on this?
You need
Okay.
to
So
state
let's-
the
okay.
motion.
Uh,
Oh, you did?
Yeah, I don't think he said the motion.
He read it.
He read it.
Okay, sorry.
Okay. But wait a minute. We can't vote on something if you didn't hear him read it, so. Can you
I'll repeat
go over it
the
again?
recommendation to the board from our committee.
Thank you.
That is to delegate the executive officer the ability to expand the board's listservs to provide more flexibility in communicating with various groups and avoid overloading any listservs with subscriber alerts.
Okay, great. All those in favor of adopting that motion, please raise your hands. Are you in favor of it?
Okay, yeah, well, I was going to say all those in favor.
Okay. Okay, it passes unanimous. Thank you, Ricardo.
Okay, thank you.
Continue.
Move on.
Yes.
Discussion and consideration of proposal to create online service tool for pharmacies providing healthcare services. A little background, the board is committed to informing consumers about new pharmacy services to meet their needs. For example, the board has created a web page that consumers can search to find locations of drug take-back collection bins. At the committee meeting yesterday, staff proposed collecting similar information on the board's website that consumers would search to find pharmacies offering other types of new healthcare services, such as hormonal contraception, naloxone, vaccinations, and travel medications. These listings would be voluntarily. The board would invite pharmacies that want to be listed on the website to provide information about their types of services, locations, hours, etc., and also to notify the board of any changes. In addition, staff suggested possibly providing links on the board's website to other websites that also provide listings of pharmacies that provide hormonal contraception and naloxone. The committee indicated a preference for a single comprehensive listing on the board's website rather than links to various lists on other websites. The committee adopted the following recommendation to the board, and that recommendation is that the direct staff to evaluate the possibility of creating a list of California pharmacies providing healthcare services for posting on the board's website and resources that would be necessary to implement the list. Any comments from the board?
Just a quick question. In the meeting materials, it listed a couple of external websites. Did the committee decide to stay only with internal lists and not to communicate external lists? I just wanted to clarify that.
Bob.
I think to start, the committee wanted to start with just the internal list.
Okay, perfect.
Good morning.
The other thing I think the committee also wanted is that, and maybe you said this, Ricardo, and I just didn't hear it, was that it, obviously it's going to be voluntary. So a pharmacy would put the information up on the list that Bob will be creating, but it'd be voluntary what they want to list. Because there was some comments that, not every pharmacy is an open door pharmacy. Maybe they don't really want to publicize whatever services they're doing for whatever reason, but so it would be voluntary. So if you want it to be known, you can be on our list.
If you want the advertisement, I guess, right? Go ahead.
Member Serber, I would just add that part of the discussion yesterday was differences in the types of lists we might have. If the board created its own list, it would have control over the content and would know who's on that list. If we link to external websites, although that information is already out there, we don't have control over the content of those websites. We also would have to vet them to make sure they meet the board's guidelines for posting links from our website to the board's website. So it was just believed that doing a single comprehensive list of pharmacies that want to participate in this voluntarily would be the easiest way to go.
Yeah, I appreciate that because I was concerned about not like you mentioned, the validity of the outside lists, but also the purpose of the outside list. Some of them are really advertising and not patient information.
Absolutely.
I did yesterday. Bob Davila is our communications director, so sorry about not introducing you in the beginning, but he does all the work behind the scenes and makes us all look really good. But he's done a fabulous job putting all these websites together, and thank you very much, Bob. I still have I need a motion. The motion is direct staff to evaluate the possibility of creating a list of California pharmacies providing healthcare services for posting on board's website and the resources that would be necessary to implement the list.
Okay, before we vote, are there any comments from public?
I was just repeating that for him.
That's okay. Thank you.
Just a quick clarification. When pharmacies are able to submit this information to the board, would it be permissible for our organization, CPHA, to submit on their behalf if we have a list of members who provide certain services? Would that be acceptable?
Sure.
That's
I
a
think
legal
under
thing.
the motion, that has yet to be determined. So that it would be, that executive officer
After
would
the
work
vote.
to determine what would best work.
Okay.
So
Just
I don't
know
think
that
that's
we,
answered.
yeah, I mean, we, obviously at CPHA, we work with our members who are happily providing these services. We just feel like we could be able to send you a whole list of folks who could provide this. Just want to make sure that that was permissible.
So from a practical standpoint, we're anticipating it being an online, web-based thing where you will actually go in yourself. So the pharmacy, whoever wants to register, will be doing it instead of us managing it. Part of what we discussed during the committee was that this would not be a staff-intense resource, and the concern would be if we implement it through other people giving us stuff, then we're manually doing a lot of work. So we're hoping that people will take advantage of an online portal to submit the registration information.
Okay, thank you.
Steve Gray, individual pharmacist. We've talked about this a couple times. I think it's a great idea, and it's going to really help those people, those patients, and those families that need these services the most to make it easy to find. So I think it's a great idea. Could you repeat the motion again? Because I think there's a word left out I think I would like in there.
Sure, let me repeat it again here. Direct staff to evaluate the possibility of creating a list of California pharmacies providing healthcare services for posting on the board's website and the resources that would be necessary to implement the list.
Okay. I think there's two words missing I would like for you to consider. One is it's absolutely critical that this be voluntary. And so I think that could be
made that very clear. It's going to be a voluntary.
Yeah, but I think it should be in the motion, just to be clear. And because there's federal law implications as to, some pharmacies are not allowed to advertise their services to the public.
Sure.
And so, that would be important. And the second one is I got to thinking about where we're going with pharmacist services. And would it be okay to add in there for evaluation at this time that it be open not only to pharmacies, but also to pharmacists? Under California law, you don't have to be in a pharmacy to practice pharmacies. Right? And we have clinical pharmacists that are available to help seniors with their medication, to help assisted living people, et cetera. And they aren't necessarily under the employment auspices of a pharmacy, and they don't work in necessarily a pharmacy. And I think those are very valuable services that the public knows the least about. And so I would like to see that pharmacies or pharmacists could go into this website and list their services being available.
May I respond? I think that we would like to maybe step into this. I think we need to think through the mechanics of the individual thing. If you would give us the opportunity to think that through a little bit at the staff level.
Well, but excuse me, but I think that's what the motion is about, to give you the time to evaluate this. But I just wanted on the record that you're going to evaluate both pharmacies and pharmacists.
Yeah, you're saying basically also since we're giving the you're saying pharmacies and pharmacists.
Right.
Give them the ability to also be
because the motion is for you to evaluate it. We're not going forward until you come back, right?
And we'll after evaluating, we'll definitely have more to add to it.
Right. And a good example is the bill 1131, where pharmacists are going to be able to offer comprehensive medication management services to Medicaid members, and they don't necessarily work in a pharmacy. Thank you.
Okay.
Okay. One more.
Comments.
My name is Ken Shell, speaking on behalf of myself. I would like to applaud the board doing this. I think it's very critical for patient care, especially for critical care access hospitals that are not open in 24 hours, which have emergency rooms. Patients come in, they get prescriptions. The hospital doesn't have a pharmacy to dispense them. Now the patient has no recourse, is filling those prescriptions. I think this is very insightful of the board to consider it at this time because it will enhance patient care and safety. Thank you.
Thank you, Ken. Is there I mean, are you interested in adding the term voluntary to this, or?
Well, we can put voluntary, the word into it, and also pharmacies and pharmacists.
Okay. Are the other committee members here?
I'm one, and I would agree with that.
You're okay with
Because I
it?
think actually, Ricardo, originally we had voluntary in there. I think it just somehow got dropped. But
I think that
but
part of the
I think that
evaluation, how
adding
we can work that in.
I see no harm in adding pharmacists and
Okay.
to it.
Yeah, we got to add just the pharmacists to the
Okay.
pharmacies.
So then, in that case, we're ready to vote. Right?
Okay.
The motion, which has now been amended to include voluntary and pharmacy or pharmacists.
Yes.
All those in favor, please raise your hand. Okay. Unanimous. Thank you. Continue,
Okay.
please.
Okay, we'll continue here. The rest is just information, won't be any motions. Discussion and consideration of a proposed brochure about pharmacy inspections. Background, at the May 2016 committee, staff reported working on an information brochure about pharmacy inspections. The brochures will be posted online so that pharmacies can know in advance what to expect during the inspection. In addition, inspectors will hand out brochures when they arrive for an inspection. Any comments? Nope. Okay. Continuing. At the committee meeting yesterday, the staff provided a copy of the draft brochure, which is an attachment 1 in your folders. DCA counsel pointed out that text has been changed to reflect that citations and letters of admonishment are not disciplinary actions, and there is no formal hearing process for letters of admonishment. The committee requested adding to the brochure reasons why pharmacies are inspected. For example, some are routine inspections while others may be related to a complaint. The committee also requested wording emphasizing an inspection is an opportunity for licensee education and highlighting the process for filing anonymous comments or complaints about their inspection. The committee indicated other information in the brochure could undergo changes over time based on public input. So as we continue with this process, we'll keep adding and we'll keep improving, and we'll make it better.
Right.
I'll move on. Discussion and consideration of the committee's strategic goals. Background, the Board of Pharmacy finalized this strategic plan in 2016. The plan includes 8 strategic goals for communication and public education. These goals are listed in the committee report in the board meeting materials. At the committee meeting yesterday, staff presented a brief status report on each goal for the committee to review and provide comments. Suggestions or directions for additional progress. The committee urges continued progress and made no changes to the strategic plan goals. Members asked what efforts have been made to collect mobile numbers for all licensees for text messaging to improve communications. As specified in Goal 4.3, staff noted that legislation was adopted requiring licensees to register their email addresses with the board but not mobile numbers. The committee asked staff to recommend changes to refresh the notice to consumer poster and point to your language notice in accordance with Goal 4.7, which relates to revising consumer-facing materials to improve consumer awareness of their rights and how to take their medications. And Bob, I'm going to have Bob go over some of the updates on the communication and public education activities by board staff. And that will cover the script, projects update, news media, public outreach, and Bob, if you can elaborate on some of that.
Sure. Just a quick update on where things stand with some of the board's important communications projects. Number one, the script. We are working to get the next script out. We anticipate it'll be out this summer. We've been sort of slowed by the move, but everything's back on track now, and I think we'll have a publication of the script this summer. Number two, we just updated the committee yesterday on some of the projects we've been working on. One that the committee has been discussing earlier this year in light of the wildfires that happened last year was helping consumers prepare more in advance for possible declared disasters. And so with directions from the committee, we put together a consumer chip of things to have in ready, things to have in advance prepared and lined up in case you have to evacuate your home to help make getting your prescriptions filled more easily should you be evacuated. We submitted that information tip sheet to legal for approval, which was given, and so we're hoping to post that on the website pretty soon. And now that we have maybe having a new listserv for public information, we may be sending that out to consumers as well via that means. In item number 3, in your attachment 2 in your board meeting materials, you have a list of inquiries we received from news reporters in the past quarter. Finally, item number 4 regarding public outreach by staff. We reported to the committee yesterday that at the board's most recent CE forum on drug abuse and drug diversion, which was July 20th in Marin County, about 80 pharmacists participated. And so far, the board has hosted 12 of these events throughout the state of California since March 2017. The anecdotal feedback we received has been all very positive. Pharmacists very much appreciate this opportunity to get this training and free CE credit as well. We also reported to the committee an update on some of the numbers we've been getting for participation in our board webinars that we have online for pharmacy law, ethics, and naloxone. And you can see the numbers there in the staff report as of the end of the fiscal year, June 30th. Almost 14,000 pharmacists have taken the pharmacy law webinar. More than 3,300 have taken the ethics webinar, and more than 2,000 have taken the naloxone webinar. So we are getting a lot of participation in this, and we hope to be adding more webinars to the board's website as we go along. And we have a full list of other outreach activities by inspectors and staff in attachment 3 in your board meeting materials. And that's the update on activities from the board staff.
Thank you.
Thank you.
I'd just like to just add, Bob Dahlia, thank you tremendously. You do fabulous work, and it's moving along great.
Ricardo, I had a comment. Since we're hitting the licensee on the DUI so hard, I think we should have some kind of information on the website to warn them about the DUI and warn them about the consequence of the DUI. Set a little more example on, give them some cases, scenarios, so they will. I mean, like I keep saying, they hear you, but they don't listen. It doesn't sink in until you see a reality, a real case. So I see on the DMV, when we get a renewal license notice, we have a sheet of alcohol level. Maybe we should, when we send out our renewal notice, we should have some kind of notice on it also, maybe something to consider.
Regarding DUIs?
Yeah, regarding DUI or whatever topic that, like I say, we have lots of case on DUI. I mean, we have a DUI case with one incident and, get the license revoked. You go to school for 8 years, and you get one DUI, one simple mistake, not even related to work related, and you lost your license. That's very severe. And then plus the consequence that you have to go to all these classes, all the drug tests, and cost them over $100,000. They don't know that. They don't realize that. They think it's probation, just 3 years, and then they're out of it, and that's it. But they don't know what they have to go through. So I like to educate the licensee a little more through the website or whatever mean we could do.
Laura, is that an issue that we can do?
No.
Could I suggest something? I'm sorry.
Excuse me. Can we discuss this in our committee and maybe come back and make a recommendation to you?
Before you do, I just want to make sure that legally we can
Oh,
do
okay.
something like that.
Well,
Are we allowed to legally put in our educational information warnings about what can happen with a licensee's license and discipline as a result of DUIs?
Well, I mean, my
I
understanding
mean,
is
we
that
can't
when you,
state
in the script,
specific
that
case.
that those, you know, when you
But
publish.
can we
in
put
You don't have to
specific
do a
cases?
specific case. I mean, you,
Can we identify specific cases?
Yes.
Okay.
Yeah, and they're actually already identified, I think, in the script on a, you know,
Okay,
in
I
this.
just want to make sure it's okay before. but
Maybe we
sure.
can highlight them and see where we're mentioning them and maybe highlight a little bit more.
Okay.
I think that's
Okay.
a good idea. I agree with you, Albert, on that. And then I just want to say that I really appreciate the CE training because we had one here in Anaheim in September, and it was really, really great, and it was very well attended. So just wanted to comment on that. Thank you.
Thank you.
Great work being done by our staff. I'd like to, future meeting dates. Our next committee meeting will be November 5th, 2019. And this concludes the report for the Communication and Public Education Committee. Thank you.
Thank you, Ricardo. I'd like to take a 10-minute break at this time. Please return in 10 minutes. Thank you.
From yesterday. Yesterday, the board voted to remove the address of record from individual licensees, and I just wanted to let the board know that we've put in the service ticket to OIS, so the address will reflect like it does where the intern. So it does provide like this, the city, state, and zip, but not the street address.
And so you put in the service ticket, so what's the timeline, you think?
It's a resource issue for OIS, and I don't know what their other, you know, projects are.
But they do recognize that we're like the most important board in the state.
That goes without
Okay,
saying.
just checking.
Oh, it's okay. We will. Okay, ready to go? Okay, now we're going to have the report from the Legislation Regulation Committee, which will be provided by me. On behalf of the Legislation Regulation Committee, I'm happy to provide the report from our committee meeting yesterday. First item, discussion and consideration of implementation of Business and Profession Code Section 4113.5, which was SB 1442, Statutes of 2018, regarding pharmacist assistants and possible regulations to clarify statutory language. Recently enacted legislation, Senate Bill 1442, added Business Profession Code Section 4113.5 regarding pharmacist assistants. Since enactment, the board has received public comments at committee and board meetings indicating that pharmacy employers may not be complying with the laws intended. Also, as part of our May 2019 meeting, the board considered a petition for rulemaking to implement Business and Profession Code Section 4113.5 regarding pharmacist assistants. Following discussion during that May meeting, the board referred the development of regulation language to the LegReg Committee. Yesterday, the committee reviewed a draft regulation proposal seeking to address public comments previously received. Attachment 1 includes the draft language. As you will note from the draft, the proposed language seeks to address some primary areas of the statute that appear to require further clarification via regulation. 1. Definition of make available to assist. 2. Background requirements for the designated personnel. 3. Policies and procedures. The committee received significant public comment on the proposal. In general, most comments seem to indicate that the approach being offered was workable. Comments expressed concern with the documentation requirement and that it may be too laborious. It was suggested that requiring documentation of exceptions when assistance was not available may be more appropriate. Others, however, stated the proposed documentation requirements are appropriate. The committee also heard comments regarding the proposed 5-minute response time. Some commenters suggested replacing a specific response time with, quote, reasonable time, but concern was raised about such language being too vague. It was suggested it may be appropriate to consider comments received during the rulemaking on this topic before making changes to the language. Further comments spoke in opposition to establishing the requirement that designated employees should be able to perform the tasks other non-licensed pharmacy personnel may perform under the provisions of CCR 1793.3 and offered that minimally trained in pharmacy operations may be more appropriate. The committee disagreed with the approach offered. Other comments suggested that provisions to provide pharmacist assistance should expand to other pharmacies such as hospitals that are currently exempt from the underlying statutory provisions. After consideration of the comments, the committee is offering the following recommendation. Recommend to the board approval of the proposed rulemaking to include approval of the proposed addition of section 1714.3, community pharmacy staffing, and initiate the formal rulemaking process. Further, delegate to the executive officer the authority to make any non-substantive changes and clarifying changes consistent with the board's policy direction upon recommendations of the control agencies. Any comments from members?
Well, of course.
Moving right along.
Yeah.
Nicely done.
Yeah. You should have tried that yesterday. So did I understand what you said, that you heard comments about making changes, but the committee decided instead of making any changes to go into the rulemaking process?
And consider those comments during the rulemaking process.
And I guess we kind of did that yesterday. We talked about it a little bit yesterday with the compounding, but I thought we decided that, well, why not just start out with something that's better and
because
and have like the
we
committee.
felt that we had a really good point to start with at this point.
Yes.
And that, you know, we will definitely consider these things in the rulemaking process. But frankly, the committee felt that what we have right now is adequate to begin the rulemaking process.
Yes.
Yeah, I mean, I guess just like we talked about with compounding yesterday, I guess, it seems to me that it would be better off to, if we can like fine tune a couple things, that we'd be better off and then move it into rulemaking so we don't have to deal with those things in rulemaking, because I'm sure we're going to have other issues come up. And one of them specifically was, you know, I think this sign-off thing, you know, I called it this
The
time.
documentation?
Yeah, the documentation. And I think you said there was maybe a solution that you only document if there's a problem.
Correct.
I'm kind of surprised that we didn't, at least, you know, something like that wasn't, because the you know, the process, because I'm thinking in reality what's going to end up happening is the process is to document, like when I ask and when the person actually comes, you know, I'm the only guy back there, gal back there, and I'm waiting for this to happen, and I'm afraid that little technicality, in order for me to do it, I mean, honestly, people are going to make it up.
We have another committee member who thinks it's easy to do.
I disagree. I think that it's, you know, you're the only person back there, so you're not going to write it down. So what's going to end up happening is, in order to make it work, you're going to just, I think it was at this time, I think it was at about that time. I mean, why not just make it an exception? I mean, I thought someone made the idea of making an exception, because then it's like, oh my God, this happened. They're going to write it down.
Actually, that was my idea, actually.
Okay.
I should have known.
I was
the non-pharmacist.
I was on the committee, and I felt that I think our motion the committee agreed with the motion, and I think we should go forward with our motion.
Okay. I understand where you're coming from. My viewpoint is, as I said on a couple other things yesterday, let's just do it right from the start. So I will probably be voting down the committee motion so that we can fine tune a couple things.
Thank you for your opinion, and we will now go to public comment. Public comment?
Good morning, Mr. President, members. Ed Howard, Howard Advocacy Inc. on behalf of USCW States Council. Thank you for the opportunity briefly to address you on the agenda item before you.
Can you speak directly into the microphone, please?
Is that better?
Yes, thank you.
We were, in fact, USCW, the petitioner that began this process, and I need to tell you, reiterating something that I observed yesterday, that your committee and your staff took the raw material of our petition, simplified it, made it far more elegant, made it far more practical, and made it far more thoughtful. And I must tell you, and reiterating again, in 20 some odd years of orbiting around Department of Consumer Affairs land, including regulatory issues, I simply cannot recall better legal or staff work than what was done with our petition.
Thank you.
And for that reason, we wholeheartedly endorse the resolution before you and the unanimous vote of your subcommittee to proceed with formal rulemaking as simply the beginning point of the process and the conversation to have the kind of discussions that were being had a moment ago. To underscore how this is simply the beginning point, yesterday our employer colleagues asked for various changes that you outlined in your opening statement on the matter, Mr. President. One of them, as you pointed out, would have substituted a reasonable amount of time for what is in fact required by the statute, which is that someone be made available at all times, where the dictionary definition of available means present and immediately ready and at hand. So that wouldn't have been appropriate for a change. The 5 minutes left was mentioned. The point is that the discussion that we saw here today is best addressed through formal rulemaking on the basis of the hard evidence and hard legal arguments that are submitted as a part of that process, vetted through public hearings solely devoted to considering and weighing them. And in conclusion, again, in the 20 years that I've been around DCA stuff, I honestly can't recall a beginning point where a board is in better positioned to begin a formal rulemaking process than this board with this draft regulation. This important consumer protection law is not being enforced. There's no reason to wait to begin the conversation of formal rulemaking respectfully. And in conclusion, for real this time, we respectfully ask that you endorse the work and the vote of your legislative subcommittee and its staff. Thank you so much.
Thank you.
So I have a question, and I get kind of the question I just asked. So this is a public hearing, and rulemaking is a public hearing. So I don't understand why not fixing some things now before we go to rulemaking. You know, why not fix it now? And why wait until rulemaking? Because it's still a public hearing.
Sure. So there are several reasons why. The kinds of public comment that are received during the formal rulemaking process are different qualitatively, in addition to quantitatively, than the kind of discussion that happens at routine Board of Pharmacy or any licensing board meeting. So, for example, there will be a whole host of voices that will participate in a formal rulemaking proceeding that may not come all the way to Anaheim formally to participate here. So that's number one. You'll have the benefit of far more voices. The second is the kinds of regulatory comment that, for example, I, in 20 some odd years, provide licensing boards or departments or agencies or whatever, is of a far deeper quality. We'll provide evidence to you, hard evidence, as to questions like 5 minutes or 7 minutes, or whether or not exemptions are best legally, whether or not the kinds of proposals that have been offered are consistent with the enabling authority legally. So it's simply a different, far deeper, more qualitative, evaluative process that likewise includes more voices than are here. So you're always at it is of course a judgment call about how good something is before you actually launch the formal rulemaking process, because if you kept perfecting it, you would both obliterate that process and make it moot, but also you know, be years down the road before you'd actually get anything out of public comment. The reason we're supportive of it is because it's what I said at the beginning. It's just outstanding work, and it's a terrific basis to begin the formal rulemaking process.
Yeah, I think that the staff or the committee did a good job in coming out with a good base, but I just obviously have said at multiple times here that I think we could fine tune it a little bit. And I usually find that the stakeholders actually come extremely prepared at our hearings. I don't really see that much difference when we go into rulemaking, but anyway, there's a vote that has to be happened.
Thank you.
Steve Gray is an individual pharmacist. I also want to compliment the committee. I think in response to Board Member Veal, I think the chair summarized the discussion in the committee very well, in that there were arguments on both sides of many things, and there didn't seem to be any general consensus on the committee to change anything one way or the other. There was just arguments on both sides. Good reason. I don't mean argument. I meant, reasons on both sides. But I think that in the formal rulemaking process, we can offer some suggestions that maybe help some of the issues. And so, for an example, I mentioned yesterday that I have a lot of experience in compliance, and the compliance from an internal point of view. And we always get into this issue about, well, did it happen? And you're never there. So if it isn't documented at the time, but I think a compromise is, the pharmacist documents when they've asked, and if there's no problem, that's it. But if they wait to document when they ask, I can never trust that. It's like when somebody's on the phone on hold and then they ask you how long you've been on hold. I've never heard anybody say, 37 seconds. They say, oh, I've been on hold for 20 minutes, because that's what they think or whatever. And so I always coach my managers to say, start the documentation the first time you have, you think you might have an issue. And then if there's no issue, nothing has to be done. So just writing down, I called for help at 1:45 in the morning because I'm the midnight pharmacist or the all-night pharmacist. And then if there's no issue, if you got somebody in 5 minutes or whatever the number turns out to be, you don't have to document that, oh yeah, see, I had the help. So I think there's an issue in what do you mean by documentation, and maybe we can tease that out in the rulemaking process, because I didn't hear a consensus. But the other thing, the main reason I'm coming up here, I just want to emphasize my concern that what we learned in the committee, again, is the frustration this board has with the rulemaking process. I mean, things have just gone on and on. We don't know if that's going to be resolved, but from history, we have to anticipate that if the board starts now, it may be a year or more before it gets through the process. And so let's start soon, but also to remind everyone that the law went into effect January 1, and that enforcement can continue to proceed. And I would encourage this to be a discussion at the enforcement committee as to how this is going to be enforced, because not only may this regulation take a long time, it may not ultimately be approved, but the statute is still there. The requirement by the legislature supporting the people of California and their safety is still there, that they have to have, pharmacists have to have help available. And once again, I'll remind, the real issues are nights, weekends, and holidays, where patients have special problems, and pharmacists need help to solve those special problems that often don't arise 9 to 5, Monday through Friday. Thank you very much.
Thank you.
Mark Johnston, CVS Health. First off, I want to say that CVS took this statutory requirement seriously. We have many CVS Health pharmacies within Target stores, and there's nobody in the greater store who's an employee to come back. So we had to add labor so that a pharmacist never works alone, not just that there's somebody available to come help at a great cost to the company. So we took that extremely seriously. Second, I'd like to say that the review of yesterday's conversations is accurate and shows that there's some disagreement, at least with the public and the rules, which I do think needs to be vetted out. And I appreciate this going through the official rulemaking process. I think what I want to comment on today is maybe a change in philosophy with the board I'm seeing. In the past, I've seen issues vetted out at the committee level, so when it gets to the hearing level, everybody's pretty much on the same page. I haven't seen much change happen in an official board hearing at the end of the process. We comment and it typically gets put in a grid and there's the staff agrees or disagrees, and it goes pretty quickly when we get to the hearing phase. And I think traditionally the board has vetted language out much more thoroughly at the committee level than releasing it late last week, less than a week ago, and all of a sudden going straight to a rule hearing process. So, I would ask the board to send it back to committee for at least one more look so that we could have, better language that goes into the hearing process.
Thank you.
Good morning. Lori Wamsley on behalf of Walgreens, and I would like to agree with my colleague, Mark Johnston. I would encourage the board not to move forward with the rulemaking process and to send this back to committee. I think there are a number of things that still need to be worked out within this proposed regulation, and I want to ensure that there isn't any unintended consequences from a patient safety perspective, as this really only impacts a certain subsection of pharmacy, and I want to ensure that it moves forward in a way that is good for the citizens of California. So I would encourage you to continue the discussion and not move it forward and too quickly.
Thank you.
I suggest we go forward with our motion.
Any other comments? No. Okay. Well, the committee recommends to approve going ahead with the rulemaking. So that's the motion of the committee.
I say go forward.
So, time to vote. All those in favor of going ahead with the rulemaking, raise your hands. As is.
As is.
All those opposed? Okay, and we have no abstentions. So it passes to go ahead. Thank you. Next. Discussion and consideration of board-sponsored legislation. During our meeting, we also discussed board-sponsored legislation. These measures can be found in Attachment 2. AB 690, Remote Dispensing Site Pharmacy. As amended July 1, 2019, this measure includes the board's provision that would establish the limited exemption to the license transferability requirements for a pharmacy required to relocate because of damage caused by a declared disaster. This measure also includes the requirements for a pharmacy technician working in a remote dispensing site pharmacy. That portion of the measure is not board-sponsored. I note that as amended, the measure increased the number of hours of experience a pharmacy technician must have to work in a remote dispensing site pharmacy. As amended, it will require 2,000 hours. The measure is on the Senate third reading file. Are there any comments by the members? Any comments by the public? Okay, moving right along. AB 973. This measure was amended May 13, 2019. If enacted, the measure will clarify that the compounding of drug preparations by a pharmacy must be prepared consistent with the relevant compounding chapters of the U.S. Pharmacopoeia National Formulary. The measure is pending consideration by the Senate Appropriations Committee. Are there any comments by members? Comments by the public?
Good morning again. Steve Gray, as an individual pharmacist. Yesterday in the Legislative Committee, I brought out something that I think the full board should consider, And that something was reflected in the discussion from the compounding committee yesterday. AB 973 clearly states that the board retains the ability to add a requirement, presumably a more strict requirement or one that's not there, to the USP standards. It doesn't say that in the best judgment of this board that it can take away a requirement that it believes is inappropriate or unnecessary. And we had, for an example, a lot of discussion yesterday about flavoring. And what I heard was that, there is something that may come up where the USP addresses something like flavoring, and this board may decide that flavoring is not compounding, like it was exempted already in our current regulations. So I would, again, suggest that the motion would be to amend or seek or ask staff to amend through the last part of the legislative process, because amendments can be made even on the floor necessarily. But my point is that this board should retain its authority on behalf of the people of California to take away something USP 795 or 797 requires if they feel that it's not in the best interest of the people of California. And so I would think that hopefully you would consider making that motion and an amendment, or try to retain the power that you currently have.
Thank you. Legally, is that something that can be done?
So, you mean can the board revise the statute to allow it to deviate from USP? I think under California law it could. I don't know if there's federal law that would require that compliance. And the policy, I think, is probably better left to the board itself. But you have another statute that would impact it. So 4342 currently requires that as well, but that's a statute as well.
So what you're saying is that
Desiree, do
we
you know
don't,
whether
we
or not
can't,
there's a
or we
federal
can't?
law that would impose certain aspects of it. So legally, if the board wanted to amend, it would have to amend 4342 as well.
So may I speak? I'm sorry.
Sure.
A couple of comments. I think one of them is this is a board-sponsored measure, and we're pretty well into the legislative cycle. I would not recommend that the board consider an amendment at this point. We are going through sunset review. We are going through the compounding process, and I believe that it would be more appropriate to allow us to review whether or not that is even feasible before the board would be taking action on something. I think that if one, we determine that it's appropriate, and two, that it's consistent and would not be creating conflicts with other law, I think that we could pursue something in the future if it was necessary.
Maria?
So I speak in support of continuing our current process and policy, and to not consider a change in policy at this time.
Thank you.
I
Okay.
speak in support of continuing our current process and policy and not seek a change in policy at this time. It would impact the work of the compounding committee to a significant degree.
Thank you. Okay, any other comments? Moving along, SB 569, prescriptions declared local, state, or federal emergency. As amended July 2nd, 2019, this measure would authorize a pharmacist during a declared local, state, or federal emergency to fill a prescription for a controlled substance on a prescription form that does not conform with security prescription form requirements under specified conditions. As amended, the patient must demonstrate to the pharmacist their inability to access medications and provides that proof of residency within an evacuation area is an acceptable manner. Further, the amendments provide that a C2 prescription cannot be provided for more than a 7-day supply and prohibit the refill of a prescription provided under these provisions. The measure is awaiting consideration and action by the Assembly Appropriations Committee. Any member comments? Any public comments? SB 655, as amended April 11, 2019, this measure will update several provisions of pharmacy law, including alignment of application and renewal requirements and other technical cleanup provisions relating to the following areas: validity period for pharmacy examination scores, pharmacy technician trainee provisions, advanced practice pharmacist renewal requirements, reverse distributor provisions, and government-owned facility fees. The measure was referred to the Assembly consent calendar. Any comments by the members? Any comments by the public? Thank you. Discussion and consideration of legislation impacting the practice of pharmacy, the board's jurisdiction, or board operations. Moving to measures that impact the practice of pharmacy or the board's jurisdiction, I note that many of the below measures have been previously considered. Copies of the measures and bill analysis are in attachment 3. AB 387, as amended July 2, 2019, this measure creates the Prescription Labeling and Adverse Drug Event Advisory Task Force to study and make recommendations on how to increase medication adherence and decrease adverse drug events. As a board, we had a support position on the prior version of the bill, which would have provided for the purpose of the medication to be included on the prescription. Staff noted some concerns with the measure and the analysis, including the deadline to complete the mandated report submission of September 2, 2020, as well as the provision of the bill that requires the board to cover all costs associated with the measure within existing resources. The measure is awaiting action by the Senate Appropriations Committee. During our meeting yesterday, the committee discussed staff concerns as well as public comment regarding the broad nature of the measure. Based on the concerns expressed and consideration of the issues, the committee is recommending that the board change its position to oppose unless amended. With the committee's recommendation serving as the motion, are there any comments from the members?
I understand why oppose.
Because of the two items that were of concern that were mentioned, which was that to complete the mandated report submission by September 2nd, 2020 is going to be extremely burdensome, according to the staff. And let's see. There was another committee's, the broadness of the legislation.
I'm sorry, what?
Go ahead.
So some of the public comment that we received yesterday was also how broad the purview of the task force was. I believe it was the Retailers Association suggested that it needs to be amended I believe their position, I don't want to speak for them, but they believe that it needs to be narrowed if this is in fact going to be moving forward.
Thank you.
Okay, any public comment? Okay, again, the committee motion is to move our position to oppose unless amended. All those in favor of the committee motion, raise your hands. Okay, unanimous, thank you. Next, AB 528, Cures Database. As amended July 3rd, 2019, the measure would require expanding reporting requirements to also include Schedule 5 drugs and would reduce the reporting period to cures to within 1 business day. We noted yesterday that the measure will also create a reporting requirement for veterinarians. During our May meeting, the board established a supportive amended position. The committee is recommending that the board change its position to support primarily because of two key provisions in amendment. The inclusion of C5s and the reduced reporting period, both of which were provisions in a board-sponsored measure last year that died in committee. The measure is currently with Senate rules. During our discussion, the committee was asked to place an item on a future agenda to discuss the challenges with canceling a prescription reported to cures when the medication is not provided to the patient. As with previous measures, with the committee's recommendation serving as the motion, are there any member comments?
I'm sorry. So are the
We're
amendment?
recommending to support because of the amendments that were made.
But I know, and so I heard that because it was currently one business day, and our amendment was that because of reversals that we.
That is there, that was a separate public comment that was received, kind of related to, but not specifically this legislation, was could the board agendize a discussion on the cancellation separate from, but related to the use of the cure system in general?
And so what did we ask them to amend?
It now includes the Schedule 5s. When it was originally introduced, it included the one working day, but not the Schedule 5s.
Okay, I didn't understand that. Sorry.
Okay. Any board comments? Public comments?
Steve Gray as an individual. I just want to point something that wasn't reported by the chair. During yesterday's comment, I asked if there was going to be a problem with this, with the lead time necessary between when it may be chaptered and when it goes into effect, and whether that was going to present a problem like we had with the prescription forms,
right,
where there was no lead time. If I can paraphrase what council provided to the board, was that this bill doesn't involve anything that we have to worry about the Department of Justice. You remember last time Department of Justice said they couldn't do anything. But I think council said it was in the discretion of the board, if this goes into effect, for example, January 1, to allow some lead time for software to be amended and for other things to be done. And I think that's important for you and the public to know, that if we have that discretion, then we aren't going to be put into a super bind again come January 1 or whenever it becomes effective.
Yeah, I think it was also stated that that's pretty much the policy of the board when we have things like this, that we do allow transition periods for enforcement. Thank you. AB 1076. Oh, I'm sorry. Yeah, we need a vote. Sorry about that. Okay, so the motion is to change our position to a support position. All those in favor, raise your hand. Unanimous. Thank you. Okay. AB 1076, criminal records, automatic relief. As amended July 11, 2019, the measure would require the DOJ to review summary criminal history information and identify individuals who are eligible for automatic relief by having their arrest and criminal records withheld from disclosure. It would also require the DOJ to provide automatic relief to eligible persons. Yesterday, I noted that in the staff analysis, recent amendments restore the ability of certain entities licensed under the Health and Safety Code, including child care licensing entities, residential care licensing entities, and community care facility licensing entities, to consider and take action on criminal convictions. Regrettably, this restoration of authority does not include the board. The measure is currently awaiting consideration and action by the Senate Appropriations Committee. Given that the board's amendments were not accepted, the committee's recommendation is to change the board's position from oppose unless amended to oppose. Any member comments? Public? Okay. All those in favor of changing the board's position to oppose, raise your hands. Unanimous. Thank you. Next is AB 1131, Medi-Cal Comprehensive Medication Management. As amended June 24, 2019, this measure would establish that comprehensive medication management services, which will be acronymed CMM, are covered by Medi-Cal and would require CMM services to include a care plan that would encompass and identify medication therapy problems. The measure would establish the minimum criteria to receive CMM services and would require the Department of Health Care Services to establish reimbursement rates for pharmacists providing such services. The measure is awaiting consideration by the Senate Appropriations Committee. The committee is not recommending any change in the board's current support position. Any comments from members? Comments from the public? Thank you. Next is AB 1264, Medical Practice Act. As amended June 25, 2019, the measure would specify that an appropriate prior examination does not require a synchronous interaction between a patient and licensee, provided the licensee complies with the appropriate standard of care. Neither the committee nor board has previously considered this measure. The measure appears to be providing clarification on how a prescriber can use alternative technologies, example, mobile apps, to ascertain information from a patient to determine if a prescription medication is appropriate. The measure is currently on the Senate third reading file. I personally do not believe the board should take a position on this bill unless there are concerns about consumer protection. Any comments from the members? Comments from the public?
Hi, Robert Stein, representing CSHP, the California Society of Health System Pharmacists. This bill,
Robert, could you get closer? Thank you.
I'm sorry. This bill, when it was originally introduced, was on behalf of Planned Parenthood to clarify the appropriate prior examination with respect to self-administered hormonal contraceptives. The bill specifically addressed the one section with respect to prescribing of that particular class of medications. A subsequent amendment moved the general language to the general prescribing statute. You read the current language. The issue that we are concerned with is that this is going to open internet prescribing up far broader than what it has been allowed under current law. And as we know, internet prescribing opens up a lot of public safety potential issues. So I encourage the board to consider an opposed position on this particular bill, or an oppose unless amended, to strike the language that allows a self-assessment questionnaire, a patient self-assessment or questionnaire to be used as the basis of prescribing a dangerous drug. Thanks.
Thank you. Any other comments? Okay. Is there anybody that wants to make a motion to take a position on this? No. Okay, let's move on. SB 159, HIV pre-exposure and post-exposure prophylaxis. As amended July 1, 2019, this measure would authorize a pharmacist to furnish pre-exposure and post-exposure prophylaxis in specified amounts and under specified conditions. Under the provision of the bill, the board would be required to promulgate regulations, including emergency regulations consistent with the CDC guidelines. The measure is currently awaiting consideration and action by Senate Appropriations Committee. During our meeting, the committee received comments noting that it is an important public health measure. We previously established a support position. As a committee, we do not recommend a change in our current position. Are there any board comments? Public comments?
Steve Gray, speaking as an individual. I support the support position. I want to start out by saying that because I think this is an important health issue. I am disappointed at the modification of the bill regarding how much Medi-Cal is going to cover, which is now severely restricted to, I think, a 60 days every 2 years of the pre-exposure on Medi-Cal. But setting that aside, What I want to point out is that it's going to require some education if it is passed, because an ordinary pharmacist, a retail pharmacist, a pharmacist can only supply this for up to 60 days of therapy unless they get an instruction from a prescriber to go farther than 60 days. And there is evidence to show that 60 days may not be enough if you look at what other states are doing and the experts. What the bill does not do was clarify that sometimes that prescriber can actually be a pharmacist. We have HIV specialist pharmacists in this state that have been working in that specialty for more than a decade, maybe 2 decades, and they take over the therapy of these patients. So a dispensing pharmacist may not realize that another prescribing pharmacist can be the one that authorized the greater than 60 days to be dispensed. And I think that just a note for staff or the communications committee that maybe should be a part of the script or part of some education just to clarify that, because this is such a critical issue for patient and public safety, because as you know, HIV can be spread throughout the public regardless of whatever your practices are. Thank you.
Thank you. Okay, next bill is SB 601, licenses fee waiver. As amended on June 27, 2019, this measure would provide authority for the board to establish a process for an individual or business to seek a reduction in fees if such an individual or entity was displaced or affected by a declared disaster. The measure is currently awaiting consideration and action by the Assembly Appropriations Committee. We previously established a support position, and the committee is not recommending any change. Are there any board comments? Are there any public comments? Moving along, SB 650, unused medications. As amended July 8, 2019, this measure would require the board to establish a cancer medication advisory committee to identify the best mechanisms to enable the transfer of unused cancer medications to individuals in need of financial assistance. When we last discussed this measure, we did not take a position. The measure has since been amended. The measure is currently awaiting consideration and action by the Assembly Appropriations Committee. As a committee, we discussed that while the policy goal of the measure is notable, the general practice of recycling medications that have been in the control of patients may not be the best way to assist patients that are in need of financial assistance to obtain cancer medication. Yesterday, I recommended that we seek amendments to empower the task force to research the best solutions to aid cancer patients in need of financial assistance with receiving ready access to affordable medications rather than limiting the scope as the legislation currently provides. After discussion and consideration, the committee is recommending establishing an oppose unless amended position to address the concerns raised during our discussion. With our recommendation serving as the motion, are there any comments from members? Any comments from the public? Okay. In that case, I will take a vote on the committee's recommendation, which is to establish an oppose unless amended position. All those in favor, raise your hands. It's unanimous. Thank you. Next, discussion and consideration of board, that concludes the legislation portion. We're now moving on to regulations. The next regulation is under the category discussion and consideration of board-approved regulations undergoing formal review by the Department of Consumer Affairs or the Business Consumer Services and Housing Agency. The board has one regulation package currently under post-adoption review. The proposed regulations to amend Title 16 CCR Section 1749 related to the board's fee schedule. The board adopted the regulation during its June 21, 2019 meeting. The rulemaking was submitted for final review on June 24, 2019. Are there any member comments? Seeing none, are there any public comments? Seeing none, I'm moving on. Discussion and consideration of board-approved regulations undergoing preparation of final rulemaking documents by board staff for final review by the Department of Consumer Affairs or the Business Consumer Services and Housing Agency. The board's regulation to update the naloxone fact sheet was adopted during the board's June meeting as well. Staff are in the process of finalizing the rulemaking prior to submission to the department to initiate final review. Staff advised me this should be completed by mid-August. Are there any member comments? Are there any public comments? Moving along. Discussion and consideration of board-approved regulations undergoing pre-notice review by the Department of Consumer Affairs or the Business Consumer Services and Housing Agency. We have a number of regulations undergoing pre-notice review. Within the meeting materials is a summary of each regulation as well as the current status. Regulations without any update and activity for 30 days are noted in red ink, and full timelines are included in the attachment. As I stated yesterday, I am troubled by the number of regulations that have been in the same pending status since 2018. I would like to ask staff to work with DCA to determine what steps can be done to address what appears to be a major backlog. It would appear to be a fair expectation to see progress with many of these regulations by the September board meeting. Members, I suggest that we receive an update on regulations at each board meeting, including our petitioner meetings, until such time as this issue is addressed. Any member comments?
So I just have a clarification. So these items, I agree with you. Like they've been out there so long, some of them I've kind of forgotten. I looked at some of the stuff and I was like, really? Right. So at this point, we can't really change anything because I feel like a couple of them, like time's gone by and maybe some like polishing them up a little bit needs to happen. But at this point, we really can't do that. We're just waiting for it to go through the process. And then once it goes through the process, if we think some polishing up is needed, we have to send it back to committee and then kind of do this all again.
Sure, go ahead.
So I think that, you could elect to pull something back. I think if you do that, there's some practical challenges, but they absolutely could be overcome. I think the other thing is notice for these has not occurred yet. So we still have the rulemaking process. And so if there were things that needed to be handled, we could handle it through the formal rulemaking process in the hopes that it moves it a little bit faster. So that's another option. We do have that scenario right now with the self-assessment forms because we're on to the next version of the self-assessment form. So we're needing to work with council to figure out how to replace that with the most recently approved self-assessment.
So to clarify, after this happens, then it goes to rulemaking?
Yes, we are in what is called the pre-review process. Okay. So once it's just like 50,000-foot view, once you all approve to initiate a rulemaking, then it's reviewed by council, it's reviewed by and it's reviewed by a couple of different offices within the department and then agency and sometimes finance. So we're in that pre-review area. You all have done your work and it's now going through the various stages of review.
Okay, so we're going to have a chance to actually
massage as we move on.
Later.
But now I'm thinking about any pharmacists left alone. So some of these have been sitting out there for a year and a half, and so we're not even, and they're not even there yet. So, I mean, this is like a year and a half or 2 years before we're going to be making
That's the problem.
regulations for that any pharmacist left alone.
So
and
I hope
we're going to even be into the rulemaking phase that we were talking about earlier for the.
So I hope that I'm not speaking out of turn because I do believe that is public information. I do think that some of this is a bandwidth issue for DCA, and they are establishing, I think it's okay for me to be saying this, right? They're establishing a regulations unit. So I think as those new staff are onboarded, I think that the expectation is probably that we will start seeing things moving a lot faster because I do think it was a bandwidth issue. So I think that I don't want to speak for the department, right? But I do think at least from my perspective, as those people get on board and they can really start working on the regs, I don't think that this will be a perpetual problem. I think that they identified a solution. We just need to move on some of these to get them keep
Well,
them a
and
little
that-
fresh.
The any pharmacist left alone is, I mean, that's already in law, right? So are inspectors already out there trying to implement something? We haven't
Yes.
even made like the rules yet. So I feel kind of bad actually for both sides. I feel bad for the pharmacists because they don't know what they're supposed to be doing. I feel bad for the employers because I'm not sure they exactly know what they're supposed to be doing, what their expectations are.
That was actually mentioned in the committee meeting, that the law does exist and enforcement is taking place, or should take place.
So can I,
Yeah.
yeah, so let me just, if I may.
Yes, please.
So without the regulation will provide clarity to the statute, but we will be assessing on a case-by-case basis like we do with all enforcement matters to determine, but the good thing about having the regulation language finalized by this board is that it shows kind of where you are from the policy perspective. And so I think that will help provide some guidance to people in the interim. And that's also providing guidance to staff on the kinds of things that the board is looking at or expecting in terms of compliance.
But so then the inspector should not at this point go in looking for, sign-offs or the 5 minutes or the list.
No.
So none of that they can really do, but that's kind of maybe the policy of where we're going.
Yes.
Right.
Thank you.
Okay.
I would add one other little piece of authority. Generally speaking, when the board has approved these rulemakings, can you hear me okay? When the board has approved rulemakings, it has also authorized the executive officer to make changes that are consistent with policy. So where there's been a law change, the executive officer has been including those kinds of things. So where there's an inconsistency with something else, then that's something that the executive officer would have the authority to address.
So other than our interim president being disgusted with the number of days it takes, do we have anything else do you have any words I know the bandwidth, but gosh, probably by November meeting, these will all be in rulemaking. Right. Do you have any words of wisdom?
Yeah. I don't have a lot to add to that, but I was going to respond also to one thing because that Ann had mentioned there are 2 new attorneys in our office that are specifically tasked with rulemaking functions, and that's their sole role. So it is happening. And
So
I
can we
think
send our
Ann's-
chocolates to them and maybe get our stuff moving faster?
Yeah.
Don't put that on the record.
Okay. 3 minutes are up. All right. During our meeting yesterday, we also reviewed the strategic goals for our committee. 1, educate the board on national pharmacy initiatives impacting consumers and the future of pharmacy. Example, pharmacists, pharmacy technicians, distributors, etc. To strategize the board's efforts in alignment with where the profession is going to be in 2020. It was noted that Ms. Harold would provide updates from national meetings she attended. Since her retirement, board staff have not had the opportunity to attend the NABP. We look forward to receiving updates in the future after staff attend such meetings. Any member comments? Public comments? Next one is support legislative and regulation proposals from board approval to enactment to effectuate the goals of the board. This fiscal year, the board is sponsoring 4 legislative proposals. Further, the board currently has 14 regulation packages in various status of promulgation, which we already talked about. And do I have any member comments? Public comments? The next one is advocate for or against legislation that impacts the board's mandate for consumer protection. During the legislative year, the board established support positions on 9 measures and opposed position on 3 measures. Are there any member comments? Any public comments? And the final one is to establish a systemized, ongoing review process for board regulations to improve and maintain clear and relevant regulations. Board staff and council are working to improve the quality of regulation packages including ensuring regulation language is clear, consistent, and necessary. Are there any member comments? Any public comments?
Steve Gray, individual pharmacist. It occurred to me as you were mentioning this that maybe staff could comment on, or council, would it help, since there are so many pending regulations that we're kind of frustrated with, would it help if the board prioritized them so that ones that we now feel are most urgent, does it help in that process for the DCA to know which ones they should be working on as a priority or in what sequence, or maybe it doesn't, I don't know, but I guess that was one alternative to consider, and I've never heard that discussed before. And then the other thing that occurred to me is the Board of Pharmacy the only one? Because I can imagine so many boards, so many regulations out there that since the DCA requires this now, pre-approval now, the work must just be overwhelming. But maybe nobody's as prolific as the Board of Pharmacy, so I don't know. So I would, if there can be any comments on those two things, I'd appreciate it.
Thank you. Okay, that ends the list of goals, and the last item on my report is to let you know what our next meeting is, which is November the 5th. Thank you all for attending and for participating, and see you at the next meeting. Thank you. We're adjourned.
We're going into closed session.
We're going into closed session. Public session is over. My report's over. And public session.
Did he do the DCA update?
Yeah.
Oh,
2020.
Okay. I didn't know.
As I mentioned before, we will come back in session after closed session, but it's only going to be, in order to